Validation test analysis presentation. The purpose for validating instruments and methods prior to use is to ensure that results are reliable, valid, and accurate without question. Reliability is yielding the same results repeatedly over time to compare and correlate the initial results. Validity is the general agreement among results. Results should be accurate without question or doubt when used in forensic science, especially for courtroom and case proceedings. New forensic methods being introduced and implemented should always go through a validation process to ensure that the method is suitable for its intended use. According to the ENFSI, validation is important to maintain accreditation within the laboratory and is highly sought after by police, attorneys, judges, and the forensic community. Validating methods and instruments promotes quality assurance. According to the ISO IEC 17025, laboratories should validate when using non-standard methods, laboratory-designed methods, standard methods used outside their typical scope, and when modifications are done to the standard method. Validating forensic science methods has become a greater concern in the forensic science community since ISO accreditation has become a requirement for all forensic science laboratories. Forensic imaging technology is widely used in postmortem examinations in the subdivision of forensic science called forensic radiology. Magnetic resonance imaging, or an MRI, computer tomography, CT, radiography, ultrasound, and surface scanning are all common methods used. In today's presentation, we will mainly be talking about computer tomography, also known as a CT scan. Instrument and method that was validated. The use of medical-grade computed tomography, also known as a CT scan, struggles to depict microtrauma and smaller anatomical structures. The use of high-resolution CT scanning is up to 100 times stronger, but it is newer in the forensic science field. Due to this type of imagery being newer, few studies have validated results to be used in the criminal justice process. Histology is the current gold standard used when examining small anatomical structures and microtraumas. In this study, a direct comparison of histology results for fracture identification and fracture age determination was compared to the findings observed on the micro-CT scans. Instrument and method that was validated and the tests performed. Micro-CT scanning was used to take a radiograph of an object through a 360-degree rotation using X-rays. The scans were conducted using specific scan parameters, which included voltage, current, and exposures varying for each of the samples that were tested. After the micro-CT examination was completed, the samples were taken to a histological analysis. These samples were dissected and examined using tissue block selection. The tissue blocks were then stained and looked at visually through microscopic analysis. We will now go into 3 different case studies that were used in this study. Case 1 was an adult larynx of a male who was 36 years old. Micro-CT analysis revealed 1 possible and 2 definite injury sites. Clear fractures were shown in the hyoid bone and throughout cartilage of the thyroid. Possible damage was observed at the base of the left side of the thyroid cartilage area, but irregular ossification patterns made this diagnosis difficult. Histology analysis revealed exact results for the fractures shown in the micro-CT scan. However, there were more fractures noted within the histology report. Case 2 of an adult larynx of a female who was 39 years old. Micro-CT scan showed fractures and displacement in the thyroid, and the trachea appeared to be partially severed. Cartilage defects were also shown, but this appeared to be a natural feature. Histology reports found the same results in their examination. Case 3 was a juvenile ribcage of a female who was 5 months old. Micro-CT tests identified 2 subtle fractures on the 6th and the 7th ribs, as well as detached fragments of cartilage. However, histology testing of individual ribs revealed 11 fractures compared to the micro-CT tests too. The standards and quality management. Second reading. In order to ensure quality of the micro-CT scans in the histology exams, a second reading of the CT scans was performed to re-examine the findings in order to determine features only identified using histology. This was a smart move for the scientists as they were able to go back and check their work and their quality standards. Analysis and review of the validation tests, method comparison. Out of 14 total bone fractures, micro-CT tests detected 5 in the initial radiographs and another 8 during the second reading. None of the soft tissue damage was seen on the CT scans even after the second reading due to insufficient image contrast between different soft tissues. Researchers addressed this problem by adding contrasting agents to the specimens. However, this caused problems as the experiments were no longer able to be reversed and caused problems on the histological exams. Analysis and review of the validation test discussion. In this discussion, we will go over the benefits and the downsides to micro-CT scanning. Overall, forensic wound analysis can benefit by advancements in technology and utilizing a non-standard practice such as CT scanning. Micro-CT scanning enables the detection of smaller fractures and helps the court jury to visualize and understand the pathological findings. More studies may be needed or further training by forensic science to ensure that interpretations and findings are not missed by micro-CT scanning, as it is a newer practice in the field. Based on this study, micro-CT scanning will not replace or supersede histological techniques in forensic science post-mortem examinations, but it is a useful addition in determining whether or not the area of damage is destructive in nature or a natural phenomena. In micro-CT scanning, a 3D scan is produced, whereas in histological exams, it's only a two-dimensional picture of a sample. Having a 3D rendering can assist the histologist in determining what the best plan for examination and cutting further slides would be. Few studies have been done utilizing micro-CT in forensic science investigations. The use of actual casework for validation is only accepted when the new method provides a general improvement to the existing technique, which is the case for this study that I have just discussed. This technique was justified and obtained validation. More studies would be recommended with a greater sample size to propose overall validation and to make assessments of the proposed method, limitations, and potential error rates. Conclusion. Overall, this study demonstrated the potential that micro-CT methods have to be complementary to histology. It added benefits such as the 3D visualization and is less invasive towards the sample. However, at this time, complete validation of this type of testing is not possible, as histology is better at measuring soft tissue injuries and precisely aging the trauma that has occurred. More research and assessments of this new method's strengths and its weaknesses is needed to determine compliance within scientific evidence regulations. Here are my 3 references used.